to Wake Med. We are delighted to have you here at our Raleigh campus this evening, and so appreciate the opportunity to connect with you. On behalf of Wake Med, it is my pleasure to welcome you. I am Betsy Gaskins-McLean, Executive Director for Patient Navigation, and cannot say enough how much this type of presentation links to the very reason that we are here in this community. Our organization provides care to over 1 million patients annually and provide the lion's share of charity care in this community. But most importantly, this event is about recognizing and living the mission of our organization, which is truly about improving the health and well-being of all of the citizens in this community and truly helping to create the healthiest capital county in the United States. It represents a shift for us, as we always want to be an acute care provider of the highest standards, skills, and caring for individuals. But most importantly, it gives us an opportunity to focus on prevention of illness, to be able to help not only the community, but ultimately, it is about helping ourselves, because it is our opportunity to be healthier in our lives. We care for some of the most vulnerable individuals in our community through our community case management programs, not only socially, but physically and emotionally. Health is not just the absence of illness. It includes access to things, as you know, like healthy food, the opportunity to be able to have access to transportation, having a safe place to be, having housing to live in, and being able to have people around you that you can connect to and be a support structure for you. Ensuring that our community case management patients have the right medical care and resources is so key to us in being able to fulfill the social needs of individuals here, and so key to the passion for me for patient care. It's exciting to be a part of collaborating and partnering with you and so many people in the community who are beyond this room, and being able to look beyond our traditional models and see how we truly can redefine what health is about, not only in this community, but represent that in leadership in our county, our state, and in the nation. The city and Wake County have already done tremendous work in creating a healthy community for all by planning a very robust transportation network, investing in affordable housing, and providing additional mental health resources in this community. I'm sure you're going to get to hear about those from our panel a little later this evening. Improving the community health is not just the responsibility, obviously, of our hospitals and the government. Each of us has a role that is critical to contributing to that health for ourselves and our fellow human beings. Tonight, we hope you will learn more about what we can do as individuals and as partners in our collaboration in this city together. It is my privilege to welcome you to this event tonight, and also to introduce our Raleigh City Council member, Russ Stevenson. Thank you so much.
Well, thank you all for coming out this evening. It's a real privilege to be here. Those of you who've known me for a while, I'm a huge advocate for designing healthy communities, and so it's great to be here amongst people who are moving things forward in a big way. On behalf of the Raleigh City Council and the City of Raleigh, I want to thank you for being here tonight to learn about what is happening in Raleigh and Wake County on the topic of public health. I want to thank Betsy and everyone at Wake Med for your hospitality in hosting the lecture here at Andrews Conference Center. It's the ideal location for a conversation about the issues that contribute to the overall wellness of our community, as Wake Med is a key partner in that conversation, so thank you. I want to acknowledge just the city staff, folks who are here. There's quite a few here, and I know they all are really excited about things we're doing in the city of Raleigh to make it a healthier community. And also, if there are members of our boards and commissions here, I want to thank them for showing up too. Tonight's event is part of the city's ongoing public lecture series, which we've named Connect Raleigh. Our goal is to bring guest lecturers from across the country to speak to the Raleigh community and help us put out in the spotlight, put a spotlight on important local issues such as transportation, economic development, sustainability, and of course the topic of tonight's event, public health. In North Carolina, public health services are provided by the county, not cities, but we are so thankful for the partnership that Raleigh has with Wake County. Later this evening, we'll hear from Regina Pettaway, Wake County's Human Services Director, who is participating in the panel discussion following the lecture. I know you'll enjoy hearing from her and learning about the great things that Wake County is doing. While counties are on the forefront of public health, there are also countless ways that cities contribute to the overall health and wellness of our community. It's imperative that city governments keep public health in the forefront of policy discussions about land use, water quality, transportation, parks, recreation programming, and so many other issues. The city's public health goals are well documented in our strategic plan, our comprehensive plan, and in other documents that influence the city's projects and programs. We have many staff here tonight who can speak to you about what Raleigh is doing in these areas, and I hope I have the opportunity to speak with you as well. So with that, it's my pleasure to introduce our guest speaker tonight, Mark Fenton. Mark is a national public health figure in planning, transportation, and a consultant with an adjunct associate professorship at Tufts University's Friedman School of Nutrition, Science, and Policy. He is a former host of the PBS TV series America's Walking and the author of numerous books, including the best-selling Complete Guide to Walking for Health, Weight Loss, and Fitness. Mark was a developer of the University of North Carolina's Safe Routes to School Clearinghouse, and he served as a facilitator for the Walkable Community Workshop series of the National Center for Bicycling and Walking. Mark was a member of the United States National Race Walking Team from 1986 to 1991 and competed in the 1984 and 1988 Olympic trials in the 50-kilometer race walk. Following his studies in biomechanics at MIT, Mark was a researcher at the Olympic Training Center's Sports Science Laboratory in Colorado Springs, Colorado, and manager of Reebok's Human Performance Laboratory. Mark loves talking to people about the need for initiatives to encourage more walking, bicycling, and transit use. Please join me in giving a warm welcome to Mark Fenton.
That's very kind. Thank you very much. Can I change that? Thank you. Thanks, Ty. So that was a very kind introduction, except that you let out my dirty secret that will keep me from ever holding high elected office, which is that I was a competitive race walker. The weirdest event in all of track and field. If you've ever seen it, you know exactly what I'm talking about. And but otherwise, that was very kind, and it's a pleasure to be here. And I've got to give a special thanks to Megan Hinkle, who has been my host in arranging my visit. Thank you for, if you hear me say anything intelligent tonight, we probably can attribute it to her. And anything stupid I say, we'll blame on me, okay? Because I don't want her getting fired for bringing the wacky guy to Raleigh, because I am the wacky guy. And in fact, I'm going to admit you that this is, to me, a recruitment trip. Recruitment and validation. For those of you that already feel like you're pushing the envelope and you're at the front of the curve of the kind of changes that you just alluded to, I want to validate that. You're absolutely right. But I also want to recruit you to push the envelope harder, because you're not done. You're doing great stuff here, and I know, because I travel all over the country, and I've recently been in both Alamance and Cabarrus counties, and so I'm in the region, I'm around the country. I worked at UNC's Pedestrian and Bicycle Information Center, as you mentioned. So, you know, I know about sort of the landscape around this work, and great stuff happening, not enough. And indeed, my other warning is this: I expect everybody to squirm uncomfortably at least once during my comments. And if you haven't, then I haven't done my job. A little uncomfortable squirming is good because it challenges us. So that's my recruitment. So having said that, here we were on a walk audit over in Durham when I was here for the statewide chronic disease prevention conference, where we didn't just sit in the room and look at the surveillance data on chronic disease and cardiovascular risk and all this stuff, but we went for a walk audit and looked at the walkability of the environment and asked, would the people who worked at the very hotel where we were meeting actually be able to go for a walk at lunchtime, as we would recommend that they do for their health, without taking their life into their own hands or putting it in the hands of drivers on a big 6-lane arterial road, right? Which is a real world challenge. I'm not making that up, as you well know. So that is, I believe, the direction we got to move this conversation. So having said that, 3 things I want to do. A little bit of personal perspective, your personal perspective, not mine. Talk about the activity, the challenge around encouraging people to be physically active, which is really one of the 3 legs of a 3-legged stool of long-term health and chronic disease risk reduction. And third, a call to action for you all to speak up, to act up, and to step up. And I think lots of you are already doing that in your work, and you're going to say, Mark, I'm there, I'm on it. Again, my challenge will be, are you doing all that you can? And if you're already here, then what does it take to get here? To the next level. All right, so that's going to be the challenge. By the way, just to give you a sense of what I consider success, Weslaco, Texas, so that's down on the border, small border town, 0 resources, none of the resources that you have here in Raleigh. But to the credit of those students in their Working on Wellness initiative in Family and Consumer Sciences, to the Public Works Department members who are here proudly in line with them, as well as the police department who help control the traffic, while those kids painted the panther paws near the Weslaco High School Panthers school crossing. They said, we don't believe people are yielding here. We want to increase visibility of this crosswalk. And it became part of an ongoing process where they've become intimately involved in some traffic calming projects around the school. But it started with them requesting and getting permission to paint the paws. And the Public Works Department, Police Department, and City Council saying yes. To me, the big outcome here, by the way, is not the existence of the paws, but the existence of that collaborative relationship that is now ongoing in that community. So having said that, let's start with a little mental exercise. This is going to seem hokey. It's going to seem like one of those silly things that speakers do. Go with me on this. There's a point here. I actually need you to close your eyes. It's one of those, the close your eyes things. And I want you to think back to your own earliest fond recollections of being physically active as a youngster. And I'm not talking high school sports. I want you to play your memory tape back as far as you can. Think about your youth, being physically active as a little kid, and think about 3 things. Think about where you were, the physical environment, who you were with, and what kind of activities you were doing. And I really want your eyes closed so you picture it. So get a picture in your mind, where you were, who else was there, what kind of activities you were doing. All right, now I'm going to make you do a goofy thing. Everybody stand up. Go ahead, stand up right now if you can, if you're physically able. Act it out for the person next to you. Act out one of your physical activities right now. Share recollections. What do you got?
Playing stickball in the street.
Stickball in the street, yeah. All right. So mine was, we ran around and played army in the woods. We'd get sticks and chase each other, you know, good guys and the bad guys in the woods running around. And we built forts in the woods. You guys build forts?
Yes, in trees.
Yeah. Tons of that. Yeah.
Yep.
All right, good. Stickball in the street. All right, good. I like it. What were yours? What was yours?
I was at my grandmother's in the front lawn with all my cousins playing football.
Got it.
Having it.
Rollerblading in the parking lot.
Got it. Okay, have a seat. All right, good, thank you. So I actually did see some people acting. I saw a lot of people standing and talking, but at least you got up. But I saw some stickball, and I saw some bike riding, I think. I saw people, dodgeball, climbing trees. I think I saw somebody climbing a tree. Okay, series of questions about your recollection. I want you to raise your hand if your answer is affirmative regarding your recollections of that period. Who of you thought largely of activities that occurred at a scheduled time at place? Scheduled activities, hands up for that. How many thought about things where you were only with kids of your gender and the same identical age as you? So if you were a 9-year-old boy, there were only 9-year-old boys, no 10, no 8. How many remembered things where there had to be an adult present to do it? How many specifically had to have a uniform to do the thing you were thinking about? How many had to have there be an umpire or a referee or somebody to do the activity? How many remember being with kids of different ages and different genders? Might have been boys and girls playing together, older and younger kids. Look around now, make sure you're looking at the hands. How many remember there not necessarily being an adult? How many specifically remember doing stuff you couldn't have gotten away with if there had been an adult there, and tell the truth, right? How many of you, a lot of us doing that stuff. How many of you are elected officials now, Russ? Yeah, okay. How many remember being drawn to water, swimming in it, fishing on it, playing in a ditch or a pond or a creek in the neighborhood, or right? Okay. Up in my part of the country, skating on it when it was frozen. How many had a wheeled vehicle of some sort? A scooter, a skateboard, a bicycle, a trike, a big wheel. But remember, this is not raising your hand. This is raising your hand. I'm not going to make you do jumping jacks, for God's sakes. Raise your hands. Okay, look about the wheeled vehicles. I just want you to see it. Last couple of questions. How many of you remember, if I may use a term of art, remember to some degree or another having been a free-range kid who could disappear on a Saturday morning and be told to get home at lunchtime, or who was in a neighborhood where they could come in when the streetlights are on? Did anybody have the streetlight rule in the summer? We did. All right, so a lot of free-range kids. Last 2 questions, listen closely. How many of you believe the majority of kids growing up today, if you're really honest, majority today are free-range kids? Hands up for that. Look around. Okay, last question. How many believe it's good for America's youth that we're raising a robust and healthy generation by virtue of them not being free range? How many? Yeah, good thing we don't have free range kids. Hands up for that. Think about what we've just said. As recently as a generation or two ago, it's not that long, even in the oldsters of us, it's 40 or 50 years, we remember a lot of free-range kids. We agree they are far fewer now, and we agree it's not good for them, to which I ask you one thing and one thing alone. What precisely do you do in your work every day to fix it? Not, my friends, that is not a rhetorical question. And did the director of planning just say nothing? Is that what I just heard? Did he say that or not?
I didn't hear that.
Yeah, give him an elbow right to the thorax for that. Because this is the problem at hand, my friends. Let's be really clear. When we ask parents, why can't you let your kid walk to school like Mark Fenton did from 3rd grade on without adult supervision? Or, take off on a Saturday morning with his buddies on a bike and a peanut butter sandwich and a knapsack to ride. I grew up in a small town along the Erie Canal in western New York State. Brockport was the town. We'd just go ride along the canal on the old towpath trail. It wasn't a bike path then. It was just the dirt trail. When we ask parents, why can't you do that? What's their first answer? Not safe. Scary men with big, thick mustaches are hiding behind every tree. The mustache men are out there. I'm not making light. I've got kids who are 21 and 23. I know there are bad people in the world that do bad things, and I know there are places that aren't safe. But you tell me, what's the actual increase in violent crime against kids by an unknown assailant over the last 30 or 40 years? In fact, let's pick the time span from about 1970 to 2000, in which the percentage of kids walking and biking to school dropped from 40% to only 15%. And the percent being driven to school by car, the red bars, went from 15% to almost half. Of course, I don't have to show you that data because you all know to avoid elementary schools at arrival and dismissal time because of the induced traffic at them, right? Am I making that up or not? Somebody call me on that. Okay. So, you know that's true. Here's the other interesting thing that happened over those 30 years. Childhood obesity rates tripled. Not a coincidence, my friends. As we get in the habit of putting our kids in the backseat of the car, even when they are going to the U12 soccer program, right? We're driving them to that. They're not hopping on their bikes and riding to the park, doing the pickup game of football in the neighborhood, right? That you walked or you rode to. No, we're driving them. This is what we've done. You tell me, what's the actual increase in violence against kids by an unknown assailant over that time? If anything, it's gone down. It certainly hasn't gone up. National Center for Safe Routes to School at UNC looked for the data on this. This special issue of Time magazine, lots of people have been discussing this. Indeed, there are now activists like this woman, Lenore Skenazy, who was the one who got yelled at for letting her kid ride the subway in the New York City subway system about a decade ago. Or the family in Bethesda, Maryland that let their kids walk to the corner park and then almost got arrested for it. No big change. In fact, did you know that the state of Utah has passed a free-range kid law to essentially protect parents against frivolous aggravation from law enforcement or Department of Social Services for simply letting their kids be free range? If they've taught them properly and not doing something. I swear to God, the Utah state legislature passed that law. And other states are looking at it. 15 other states are now looking at it. There's a real concern about this. No, if we want to talk about what changed over that 3 decades, maybe we'd go to this special issue of Time magazine, which explored a disease that when I began working in public health was called Adult-Onset Diabetes. That's what we called it in the clinical setting. What's the actual clinical term for that type of diabetes? It's called type 2, right? And we don't call it adult onset anymore because we now see it in 9-year-olds. Because elementary school nurses have to be prepared to potentially take blood glucose measurements of a type 2 diabetic 9-year-old, 3rd grader, right? That's possible. This is the change that happened over that 30 years. Now, I'm going to admit some other things have changed, right? I mean, people would say, well, more parent households where both parents are working, more single-parent households. But would you not also agree that the landscape changed dramatically, that traffic speeds and volumes and vehicles are higher and bigger and faster, and subdivisions that didn't exist the way they did back then exist now, that the entire physical landscape has changed, and that we better look at that as we look at these problems. Okay, now I'm going to admit, by the way, there are really 2 risk factors, other than your genetics, 2 risk factors that increase your risk for type 2 diabetes. You tell me what they are. Other than, say it again. Diet and exercise. Poor nutrition, being physically inactive. And indeed, if we want to talk about what fills the hospital beds here, if you were going to say the statistical reality of what the majority of the beds are full of, 3 risk factors that are all behavioral. Tobacco use, physical inactivity, and poor nutrition. It's manifest as cardiovascular disease and stroke and kidney disease and osteoporosis and the complications thereof. But the big 3, the 3-legged stool of chronic disease risk in this country are tobacco use, physical inactivity, poor nutrition. So I'm going to talk about physical activity, not because it's the most important of the three, it's the one that's relevant to our work, and particularly, I think, the Connect Raleigh movement. It's very connected to the things you were just alluding to, Russ. So I get that perspective because I was, if we believe what I said a moment ago, a competitive athlete, if you can call it that, in the weirdest event in track and field. Here it is, photographic evidence that I was, in fact, a race walker. And you can tell it was a very long time ago because we only had black and white photography back then, and those shorts were actually in style when I was competing, I swear. This is, of course, the 1928 National Championships in Washington, D.C., and many people will ask, Mark, why of all the events you could have done did you pick race walking? It's obvious when I show you the next picture. Of course, it was the huge crowds that showed up at our competitions. This is the truth. I'm not making this up. This is the start of the 1984 Olympic trials, 50-kilometer race walk. 50 kilometers is 5 miles longer than the marathon, so it's the longest foot race in the Olympics, 31 miles. It begins on the stadium track. You go out, you do a loop, come back, just like the marathon runners do. And they start you very early in the day to avoid the heat. So when we finished at like 9:30 in the morning, the stadium was packed because the real events were going on, like the decathlon and the shot put. But at 6 a.m., and this is the LA Coliseum because 1984 LA hosted the Olympics, if you remember, so that the Olympic trials were. If you look very closely at 6 a.m., you can in fact see my mom and dad right there. Really them, not making that up. My mom's like, way to go, sweetheart, just 30 miles to go, honey. Yeah, thanks, Mom, as I'm walking along, doing my, thank you, Mother. So, I've been studying physical activity, exercise, science, and all that stuff. You know, this is like 35, 40 years ago that I really cut my teeth. And I'm going to summarize it in just a few slides. The whole story you need to know about physical activity and exercise and the benefits. One, we know we should be physically active. National guidelines tell us if you could average about 30 minutes most days of the week, if kids could average about 60 minutes, we'd all be at reduced risk for cardiovascular disease, type 2 diabetes, osteoporosis, clinical depression, dementia in old age, and a growing list of cancers. American Cancer Society lists sedentary lifestyle right next to smoking as a risk factor for cancer. There's just reams of data on this. And by the way, everybody thinks it's got to be like this, but the data tells us that it can be broken up throughout the day. It doesn't have to be formal structured exercise. That gentleman riding his bike to or from work in Cary when I was visiting last time, if he rode 15 minutes each way, he gets the 30 minutes, as long as he doesn't get killed on the way, right? But from a cardiovascular disease risk standpoint, he's benefiting by getting incidental physical activity part of his daily travel. Okay, that's important that we recognize. That's the good news. It seems like an attainable goal, that we don't have to train for a marathon. Just get a 30-minute walk every day. The bad news is we don't. Our recreation is increasingly sedentary and screen-based. Our jobs are increasingly so. Our transportation most certainly is. And as I showed you the data before, kids aren't even getting it because we're really pulling physical activity out of the routine tasks of their daily lives. In fact, the estimates tell us that maybe as few as, no, this is not estimates, I'm sorry. This is objective data measured on by things like pedometers or Fitbit devices that actually measure your movement. About 40% of youth, 10% of adolescents, and get this, fewer than 5% of adults meet the 30-minute per day guideline. 1 in 20 people. You, who think about health and so on, probably are not a representative sample of the population at large, because we know 1 in 20 of us are maybe getting the 30 minutes per day on any kind of regular basis. That's pretty grim. We also know simply telling people is not enough. We've been trying for 20, the Surgeon Generals, the Centers for Disease Control have been saying exercise is good for you. Your doctor, right, you get the high cholesterol reading, go for a walk every day. But in fact, that's not enough. This is actually a CDC conference at which they made us get up during the breaks and do Zumba class and stuff. Fine, when you're in our face, we'll do it, but just then. And I'll show you data that bear this out. This is a quick explanation here. This is a study done by a really good researcher, John Jakisik, in the Journal of the American Medical Association. Did a very simple thing. Tried to get people to walk 40 minutes a day in an intervention trial. They volunteered. 3 groups in the study. One group told walk 40 minutes all at once. Second group could break it into 4 10-minute walks if that was more convenient. Third group could not only break it into 4 10-minute walks, they put a treadmill in their house. So you could go jump on the treadmill anytime you wanted. Then over 6 months, they did all the things that we believe work from the research. So called them on the phone, sent them email reminders, gave them a pedometer, encouraged them to warm up properly beforehand and stretch afterwards so they don't get injuries. Help them select a good walking shoe. Have an exercise diary. And if they filled it out and turned it in, they got prizes like t-shirts and water bottles, because we love giving away t-shirts and water bottles in health promotion. We do, right? We do this all the time. Ken, in all sorts of recreation programs, we're giving away t-shirts, water bottles, fanny packs, baseball hats, right? All this stuff. It works, by the way. The reason we do that is because you'll note over the first 6 months of the intervention, everybody increased their exercise minutes per week, which is not the interesting question. The interesting question is what happens after the intervention is over and I'm not calling you on the phone anymore. I'm going to tell you that one of those 3 arrows represents the trend for the group, and I want everybody in the room to vote for one of the 3 arrows, but first, I'm going to give you inside information, which is this. At this point, 6 months, John measured statistically significant increases in aerobic fitness and decreases in weight. So they were walking 30 to 40 minutes a day. Over just 6 months, they've started to lose weight and they're more aerobically fit. Objective measurement, no self-report. Put them on a treadmill, measure fitness. This is a big deal. Great study. Now you tell me. Everybody votes for one of the 3 orange arrows. Everybody here has to raise a hand for one. How many believe they continue to increase their exercise minutes? Oh, that's pretty grim. How many believe they at least maintain? On average, this is the average trend for the group. That's not raising your hand. This is raising your hand. Own it. Thank you for your optimism. And how many believe it dropped off? You're all losers. You have bad attitudes, and I should send you away with no more snacks, except for, of course, that you're right. Whenever we do studies like this, we see this fundamental problem, which I call the stickiness problem. It is not that we can't get people to try, it's that we can't get it to stick. And I'm going to argue that's because they still live in the same world that doesn't have a sidewalk out in front of their house, or that they have to cross an arterial. Make the point out loud, because I want to address it. What did you just say?
We said that they ended up worse than when
Why are they worse than when they started? You tell me. Because they signed up for this program. They came in with intent, right? Maybe their kid's wedding is out here or their high school reunion. I'm going to lose weight, or maybe this is January and they've made the resolution, right? Going to lose weight. And so they hang with it for a while, but then they still live in a neighborhood where they have to cross 8 lanes of traffic in a center turn lane just to get to the park across the street, right? The environment didn't change in 12 months. They still live in the same world where they've got to drive a kid to school here and to work over there. And you guys get the point, right? The only thing that changed was their intent, which is not enough. What does work is social ecology. Those of us that have been working in behavior around health have known about this for a long time. This is nerdy behavioral psychology, but go with me on it because it's really, really relevant. So what it says is you can't just tell the individual what to do, but the groups that matter to them, like family and friends, institutions like their school, their workplace, the community by its physical design, and even policies all have to direct them in the direction you want. We have a great example from this in public health, and it's around tobacco. Right? Because we don't just say don't smoke, it's bad for you. That's the individual. Here's your nicotine patch, your gum. But we create smoking cessation groups, and your workplace and your healthcare provider will pay for that. Institutional support. I'm sure this is, I hope, a smoke-free campus 24/7, right? So we make those kind of institutional. We make that commitment at the community level, bars and restaurants, increasingly public places, parks and playgrounds. You guys there yet? Smoke-free parks and playgrounds? Working on that? How about multifamily housing? Are you there yet? Because that's the next frontier. Multifamily housing, smoke-free, right? So lots of policies. Warning label on the side of the package. This will kill you. Don't advertise on television. Tax the daylights out of the product. Does everybody agree we operated at all those levels and in our lifetimes, in my lifetime, changed social norms? When I was a competitive athlete, I had to ask to sit in the non-smoking section of an airplane. Do you remember what that meant? Imaginary line, me in front, smoker right behind me. Smoking. Does anybody else old enough to remember that? Okay. Not anymore. My kids will never be exposed to secondhand smoke on an airplane because we changed the law, policy. Not because we ask people don't smoke on airplanes. Okay, smarty pants, fast talking guy, how do we solve that problem? Why is she the only girl walking to school? So we can do individual targeted programming. It's not enough. We could set up what are called walking school buses. Who's heard of that? The idea of it's a designated route to school that parents will walk. My wife and I organized them in our neighborhood. Neighbors from the community took turns walking the kids, putting at ease parental concerns for safety, helping them cross the street. Great, not enough. So at the institutional level, let's incorporate messages around health and physical activity right into the curriculum. How about bike safety training? How about pedestrian safety training in PE class? Good, not enough. I mean, this is a comprehensive Safe Routes to School program, but still not enough. Let's build the trail like they did out in Boone that connects the school complex to the regional park where their home sports fields are, where the cross-country team runs. And then let's encourage parents who are coming to meet, not just have the kids walk to the meets over there, park at the school and walk with your kids. This becomes the spine of a greenway system out in Boone. Still not enough. So I'm going to go to my school, back to the one where my wife and I did the Walk to School program, and that was a walking school bus. One of the problems, one reason parents said they can't let their kid walk to school is because the traffic at the school was so bad that they felt it was too dangerous. They said they're going to get run over in the last 300 yards. All these frantic parents taking off at dismissal time, white knuckles, right, from the line. So we said, what about if we could create a remote or a satellite drop-off pickup location? So we reached out to a church about a third of a mile away, big empty parking lot, and said, could parents pick up and drop off here? Would you? And they said, we'd partner with you on that. Yeah, we're happy to make that a policy. This is a place, we're going to encourage that. And we put in a 5-minute safety delay on the dismissal line of cars at the school. So at dismissal, you released all the kids to the school buses, all pedestrians and bicyclists were released. Anybody going to the car line had to go to the cafeteria and hang out for 5 minutes. We moved all the kids off the campus, across the crosswalk here. Now they're going down the street to their walk home, and then the car line starts to move. What did we immediately hear kids start to say to their parents? Under no circumstances pick me up at the school. My friends are out having fun, and I have to sit in the cafeteria for an hour. It was 5 minutes, but to a child at the end of the school day, might as well be an hour, right? It could be infinity. They just like, get me out. My point is this. We can do all that stuff. It's great. It's not going to create the sticky long-term change. Remember the curve? Sticky? That happens when we change the physical infrastructure of the community and policies to support the behavior we're looking for. Make it hard to smoke in public places. Tax the daylights out of the product. Make it easy for walking and bicycling to be the preferred choice for me to school. So, Mark, is there any evidence that we can build such places that are indeed stickier for physical activity? And the answer is absolutely yes. You can go to the planning journals, you can increasingly look at the transportation journals, and a lot of the public health literature is looking at this very question. 4 things characterize settings. This is a gross oversimplification. You could argue with me if you wanted to, but I think it's a pretty fair summary of what we see from the research. 4 things. 1, a greater mix of different kinds of destinations in proximity. 2, good network of facilities to connect those destinations, sidewalks, bike lanes, multi-use trails. 3, when I get to a destination, it rewards me rather than punishes me for showing up without my car. It says, you're welcome here as a pedestrian. Feel good here as a bicyclist. Here's where you park your bike. Here's where you sit. Here's where you get a drink. Here's where the building is, right up at the sidewalk, not set back behind 3 acres of parking. And it's safe and accessible for everybody in the community, all ages, all incomes, all abilities, all races, all disabilities. Everybody is welcomed by the very design of the environment. Right? That's in the research. By the way, great resource. If this is at all new to you, and I'm sure it's not because of the room, who's here, but that's a great website maintained by University of California, San Diego that sort of has a bibliographic summary of some of the best research that really bears this out. And this isn't news. The notion, you go to a planning conference, we talk about this all the time, right? We're talking mixed use all the time, right? Compact neighborhoods. Don't give everybody a big yard. Have shared open space that's accessible to everybody. Make it linear. Make it a greenway. Have neighborhood schools. We were talking about Morganton, some of the people out here earlier, how they've really devoted to some of the work in downtown. We were talking about they've changed even to back-in angled parking to support bicycling down there. Building at the street trees, awnings, benches. We know the network matters, right? Sidewalks, multi-use pathways, bike lanes. I want to be very clear. There is very good and growing research that says regular transit riders are statistically more likely to get there 30 minutes per day. Not because athletes choose to ride transit. The incidental act of getting to and from the bus or the train at either end of your trip. Remember, you only have to walk 7 minutes to the train, 7 minutes or to the bus, 7 minutes from the bus to your destination, and then reverse that trip. 4 times 7 is what? Sounds like 30 minutes to me, right? Incidental walking can give you your 30 minutes. So building the network is another critical part. Third, again, the destination. Is it what we built for the last 60 years, or is it what we built for the hundreds of years before that? Buildings at the street trees, awnings, benches, bicycle racks. I do not allow anybody when we're creating planning documents to call things like benches and street trees and awnings amenities. Because they're not an amenity to my mom, who at 80, if she's deciding to walk to the pharmacy down the street in downtown Raleigh, and she's trying to make a decision, if there's a bench under a shade tree on a hot day in August, maybe she walks. Take that away, she doesn't. It's not an amenity to her, it's a functional attribute. It's a piece of street furnishing, right? As is the bike rack for the bicyclist that wants to park there. And last but not least, it's got to be safe and fully accessible for everybody. Here's where I'm going to defend my discipline. I think engineers have done magnificent work in innovating and learning about how to do these kinds of things well. Median islands, roundabouts, simple things like curb extensions, which we know shortens the crossing distance, slows the turning vehicle, improves sight lines, right? Very simple, just changing the width of the sidewalk at the intersection at the crossing. And my only point in telling you this is I'm sick of the engineers being blamed because, frankly, there are a lot of tools in the toolkit, but if all we say is, we just don't want people to have to sit through 2 light cycles to make a left turn at peak hour. Then we get horrible things like double left turn lanes, and we take all this stuff away and we worry about just moving more cars faster. If we say we'd like to build a place where pedestrians, bikes, and motor vehicles can coexist, well, we can do that. We know how to design that stuff. Is that fair as an engineer? I'm looking to the two of the engineers who I've met in the room. So, my challenge to you. I want you to speak up, to act up, and to step up. So speak up is indeed talk about this. Let's raise the level of the conversation. Let's not let this be the weird sort of obscure stuff that's talked about in the worlds of people who care about smart growth and new urbanism and kind of nerdy bike advocates who are nice people, I love them, but they're nerdy and they show up at public meetings with a helmet under their hand in Lycra and with their cleats on. So when they go to give testimony before city council, it's like clomp, clomp, clomp. And it bums me out because sometimes it's alienating. Even though they want to make great testimony, I really appreciate it. I want moms who push strollers. I want grandparents walking up and making that same testimony. Because if it looks like it's just the fringe crowd, then they get treated like the fringe crowd in our decision making. I see this all over the country. I'm not making that judgment about here in Raleigh. I'm just saying around the country that's an issue. Act up. Be a change agent. And step up. Be a role model. So let me talk about this. When we talk about it, we need to talk about the very things you were alluding to, which is the triple bottom line benefits of healthy design. So the prescription I gave, I would argue, is an evidence-based. That's based on the research. You could argue with me, you'll lose. I can show you all the studies that back up the 4 elements that I just talked about. But what we are also seeing is places that invest in that are not just seeing healthier people being more physically active. They're seeing a healthier environment, less traffic, less stormwater runoff associated with giant parking lots. The air quality is better because they have less traffic congestion, right? Vehicles sitting at lights. But a healthier economy. And this is huge because we're seeing businesses are more robust in more walkable districts, for example. Turnover is less. Businesses want to locate in these kinds of communities. So it's now being alluded to the people, prosperity, and planetary benefits of healthy design. Okay. This is very important to making the point. Even to the most reticent, for example, elected official, hard to argue against that one. Right? So I'm right with you on that. Indeed, let me tell you that national organizations that care about this stuff are telling us the marketplace wants us. People want to live in more walkable. This is a publication of the National Association of Realtors. And this is one of the National Association of Builders, in which the headline there of this special issue was Walkability, Why We Care and Why You Should Too. They're talking to home builders. They don't care if you get 30 minutes of physical activity a day. They care that they drive the last nail, sell the house. What they're saying is walkability sells. That people are looking for this, right? Across the age spectrum, across the economic spectrum. And indeed, because that's what the next generation of employees is looking for, businesses are now wanting to locate in these kinds of cities that are investing in these elements. Raleigh is in a competition, and not just with Chapel Hill and Durham. You're competing with Boulder, Colorado, and Silicon Valley, and Boston, where we will kick your butts at this, because we are investing in bicycle and pedestrian design, but we have winter and you don't, so you kill us if you do this stuff. This is a white paper that summarizes the research, and interestingly, it talks about the next generation of young professionals are indeed driving less, biking more, taking transit more. Indeed, when you look at 16 to 24-year-olds, the rate of driver's licensure is the lowest it's been in decades. It peaked in the 80s at 80%. Now we're down to about 60% of kids in the 16 to 24-year-old age range even have a driver's license. I've got a daughter, 21, no driver's license, going to school in Cambridge, Massachusetts. Not only does she not have one, she doesn't want one, and she says, and the last thing I want is a car and all the costs associated with that. I can ride a bike, I've got a scooter, not one of the electric scooters, just a regular scooter. I can walk, I can bike, I can take transit, I can do Uber and Lyft. That's the next generation. But let me be very clear, they're not the only ones interested in this. We know that empty nest baby boomers are very much looking at these kinds of communities because we're imagining the day we can't drive anymore, and I still want to be able to walk to a coffee shop and a brew pub and a couple of nice restaurants and a pharmacy and maybe a healthcare provider, or at least to a transit system that gets me to my healthcare provider, right? So we're seeing 2 huge chunks of the population in particular very interested in this, and the businesses that both serve them and employ them want to locate in the communities that are doing this. You're in a competition, and you can win or lose by how well you do this. So let me just say that. There's market demand, there's market performance. We are seeing, there are even studies of streets. So we were talking before about Sedec and Bloomberg in New York City, where they did before and after studies of the retail activity on streets that had major redesigns. I'm talking crazy stuff, like the stuff where they took a travel lane away and made it a dedicated bus and bike lane, or a protected bicycle lane, you know, one of those bike lanes where there's a buffer strip. Hugely controversial, going to be a disaster. Retail activity, and as a result, tax revenue on those streets went up. Wait, Mark, How can somebody on a bike possibly buy as much as somebody who drove to those businesses? People drive, they can buy a lot. They ride their bike, they can't drive as much per visit. And in fact, the data showed that. They don't buy as much per visit. What do? Visit way more often and hit multiple stores when they visit, because it's a humane street that actually invites them to do that. Park your bike, walk in that store, cross the street, because you can now, and hit those two, right? So the data is telling us we've got a very different picture. The other thing is, the development community wants to know, what are we going to do with this first generation of malls and boxes that are at low tenancy or that are just empty now? And the kinds of stuff you're seeing at North Hills, right? We drove by that on the way out here, where we're densifying, where we're mixing uses, housing, retail, business, make it a transit hub. That's the new game, and the developers are interested in it. I'm not telling you anything you don't know, I'm just reminding you. This is my validation part. Act up. We're going to be really good at this. It can't be one-offs. It can't be one cool project here, a nice section of trail over there. We're going to change the rules. So do what you've done. Adopt complete streets as a matter of course. Say, this is the new normal. When we design a street, this is right off your website, right? This is one of your streets that you've done. Proudly, you show that on the website as well. You should, with traffic calming, the median islands, so low impact development practices, capturing water, all the kind of stuff. So we know that complete streets take into account all users every time we touch them: pedestrian, bike, transit, and motor vehicles. We don't just design for cars, and if there's room, stick a bike lane on the side. We say, how does this corridor take care of everybody? As an engineer, I'll tell you, we're having a different conversation. It used to be those were the gold standard: level of service and average daily traffic. If I could move more cars at a high level of service, right, where not a lot of delays at intersections and things, then I win. That's what the LOS is. I'm oversimplifying greatly, but it's a measure of sort of delay and hassle to the driver. And we don't see them as the only way to measure performance anymore. Now we're asking things like, are we actually reducing total vehicle miles traveled by a project like this? Are we improving the mode split so that we see more bicycling and pedestrian and transit activity? Well, when Sandy Fork now has a sidewalk and has actual bike lanes, I'm going to expect that to happen, where those modes are now going to be more accommodated, right? So congratulations to you guys for doing that kind of stuff. Obviously fewer collisions, but we can measure roads in other ways now. We can say, how about stormwater runoff? How about the heat island effect? How about retail activity along that corridor? How about access to our lowest income residents, who are, by the way, we know the ones at greatest risk for chronic disease? Do they get access to more walk and bike friendly places? Simple thing that I've worked with a number of communities to do, just change how they evaluate when development is happening, what needs to be done to accommodate that development. So historically, we've asked for, when a new Walmart or a housing subdivision or something comes in, we have to do what's called a traffic impact analysis, and we have to estimate the number of car trips. Then we often work with the developer and make them help pay for the signal light and the turn lanes and all the extra stuff we're doing for the cars. Well, why don't we make them do a multimodal transportation analysis and estimate the number of pedestrians and bicyclists and transit riders? Then maybe we'll make them put a pedestrian connection in, out to the transit stop, provide bicycle parking for the employees. How about actually a bike fleet? I know you guys are talking about bicycle share. One of the simple first steps to that is have individual entities have bikes on site for their employees, mini bike shares. Wake Med could have a handful of bikes here if there's anything you could ride to safely from here, and I'm not judging that, I'm just saying, right? Individual businesses could say, we've got a fleet of 6 or 8 bikes our employees can use over lunch hour, before and after work. It's a first step toward bike share. Change our subdivision design guidelines and our zoning ordinances to say we're just not going to build more subdivisions with roads wide enough to land a 747 but no sidewalks. Not doing it anymore. We're going to require the sidewalks. We're going to narrow streets. We're going to include bike facilities, right? And just in case that's overwhelming, you say, Mark, I don't have anything to do with the zoning ordinance. That's that guy. The planning guy's talking about that. How about this? In Whitefish, Montana, we did a walk audit. We went around, walked near the schools, and people were saying, well, this would be, our kids don't really ride bikes and walk to school because we don't have a place for them to ride on the street. And as we did the walk audit, I identified this as a fairly wide street. I said, I'm not convinced you need car parking on both sides. It's a residential street. People have driveways. Could you do a protected bicycle lane on one side of the road? They said, yeah, I'm not sure the culture of that it would fly here. Parents probably wouldn't let their kids ride anyway. Would you ever try it? On a short term, would you do a pop-up, a demonstration for a week? During Walk and Bike to School week, why don't you create a temporary bike lane and just see what happens? They did that, and they filled the schoolyard with bikes. So much for our kids won't ride. They're now striping bike lanes and building an actual bike network there. This short-term demonstration or trial opened the door to this. Livingston, Montana. I'm giving you 3 Montana examples because the Department of Health there is working with the Department of Transportation to actually encourage this kind of activity at the community level. Near their farmers market, school on the left, regional park on the right. Note the goat trail, the desire line. There's clearly pedestrian activity here already. And they said this intersection is a problem, especially at farmers market time, on the weekends, a lot of traffic, chaotic. Said it's the kind of place where a small circle, not a big giant roundabout, a mini circle would work. I don't know if that'd fly here. Said, why don't you test it? Let's find a low-cost, safe material. What could we possibly use? How about that? So they built a mini circle out of hay bales and had the trucks from the farmer's market try it to check the diameter, had the biggest fire truck in the fleet come and prove to themselves that that would be a viable treatment. They also created curb extensions, a bike lane. In Billings, Montana, they identified this for their walk-to-school program as a key crossing. It'd be a great place for a curb extension to narrow the lanes, slow the traffic. Mark, we don't have the money to tear up the concrete, pour the asphalt, put in the granite. Could you do temporary rubberized curbing, paint, and a sign? So they did that in 2008. When this road, Poly Road, came up for repaving in 2015, they made it permanent because they'd convinced themselves with that short-term low-cost treatment that they needed it, that kids would use it when they provided the facility. I don't want to let the decent be the enemy of the great. In fact, let's make it a stepping stone. Do the decent treatment, test it, learn from it, move ahead. Act up. Be the person that asked for this in your community. How about just bike parking? This is just a nice example because I've seen it happen in my town. I live in Scituate, Massachusetts. Our teams are the Sharks. So we worked with the local vocational school welding program. The kids at the VOTEC actually designed this Shark. In North Adams, Mass, the VOTEC program, does everybody see the acronym there? NAMA for North Adams, Mass. The point is, there's a real sense of ownership. The kids do the fabrication. Local businesses or philanthropists donate the money for the steel, and we've ended up with bike racks all over these communities. We're doing this all over the country. And you, by the way, end up with iconic bike racks. I have literally had parents tell me, my kids make me ride the bikes. We ride bikes to the library because they want to park in the Shark. And that's a thing you do in our town now. That's a win for me. It's a public health win. There's guidance out there. If you were to say, I don't even know how to start this stuff. In fact, we're finding a lot of cities that are helping do this, but this is a great example of really inexpensive stuff, pop-ups, demonstrations, curb extensions, parklets. My point is there's a movement around this, and there's plenty of evidence about how to do it well. If you don't do anything else, step up. By your own behavior, you invite others. So every time you choose to walk for a trip rather than drive your car, and you say, Mark, I live 20 miles outside. Okay, so your commute trip isn't the one that's going to change. But maybe when you're in town, and sometimes you'd hop in the car to go to the bank or the post office or to a meeting, could you walk? Could you bike? Could you have, if you don't have a bike, could you say, maybe we ought to get a few bikes, keep them right here at the office so that when we go across town, we could do that, right? When we go across campus, when we go to the other side. Because one of the things we find, when people say, oh, trails don't feel safe, I don't feel safe out there, one of the things that makes people safe first, before emergency call boxes and lighting and everything, is the presence of others. So by your action, you invite others to be out there. We know the environment matters. Programs, encouragement, they are not enough. You need to keep doing this work on the environment. And we know how to build active settings, and you're doing lots of it, but you're not doing all of it. And I know I'm being a pain, but you also know this. Keep pushing the envelope. Get better at it. Make it comprehensive, make it policy. Never build anything new without doing a multimodal transportation analysis. Never touch a road, even if you're just digging it up to fix a sewer, to ask, could we make this a more complete street? Could the 12-foot lanes go down to 10-foot lanes because it's posted 25 miles an hour? And could that 2 feet go to the current shoulder and become a bike lane because it's wide enough now? That kind of a retrofit, just moving lines, can work in some occasions. I need you to speak up, particularly to your leadership in the community. Don't let Russ be a lone voice on this. You want all of the planning commission, all of city council, all of the school boards to hear this at every meeting. Act up for change in your community. Step up yourself. Be the agents of change. It's happening in big cities and tiny all around the state. The little redesign, by the way, has anybody been out in West Jefferson since they've done some of that work on that little main street? They argue that it's part of the economic rebirth of that little downtown, right? They would tell you that. Mayor would. I mean, I talked at length with them. They were very proud of what they've done. A lot of it with paint and signs, not gazillions of dollars. We can do some of this stuff on short money. My last point. I'll be in a conversation with a city council. In fact, there's my town, Scituate, Mass. When we were trying to get this trail built, we had a couple of we call them selectmen up there, the board of selectmen. One of the guys sat back and said, I can't believe we're going to spend money on this. Nobody's going to walk there. Who's going to use this dumb trail? I'd never walk there. And they go to the first person. That's their final line of defense, because you can't discredit that, right? If he says he's never going to walk there, I can't disprove. I've got data about all the other stuff I've talked about, but I can't prove that he's going to ever walk there. And I used to say, the answer to that historically was, by the way, I give the American River Trail because that is a gorgeous trail that goes from downtown Sacramento, the old town, all the way out to Folsom Reservoir. It's something like 30 miles. The last 2 miles were the hardest to complete because of the right-of-way issues. They ended up putting a portion of it practically underneath the elevated expressway, the I-5. Everybody see that there? Hardest portion to complete. And people were saying it about that. Nobody's going to ever ride a bike there. And it used to be we would say, oh, but we've got to provide choice. Some people will. Don't we want the people who want to walk them? I'm not doing that anymore. I'm not being obsequious. I got a new script, and if you would like, I will share it with you. Would you like to hear my script for that? Are you sure? Yes. Okay. Because when they say that, nobody's going to walk there. I can't believe it. I'd never walk there. I go, here's my answer. Shut up. I don't care. Okay, I don't say this part, but I do say the next part. I say, it doesn't matter whether you ever walk there, because you don't have to, and you're going to still benefit. If those people walk or ride or take transit, walk to school, every one of them is a car on the road that you're not competing with. And when you get downtown, it's a car you're not competing for a parking space with, right? And when you breathe the air, you're not breathing their emissions. And when the floods come, maybe they don't come quite as quickly because the greenhouse gas emissions weren't quite as bad because they didn't drive. Oh, and by the way, we're all in the big insurance pile, so when they don't have a heart attack, your premium doesn't go up. Shut up! Sorry, I forgot to take my pill. I'm okay though. You know that I'm not entirely kidding. I've been doing this for too long. I've got too much gray in my mustache. And the real reason I'm a froth at the mouth lunatic about this, quite frankly, goes right back to the beginning of our conversation. I told you my kids are 20 and 23, right? This is them frozen in time at 3 and 5. To remind me, they're part of the first generation that is going to end up with statistically shorter life expectancies than their parents. Not, my friends, because of Ebola or avian flu or HIV. No. Not because of infectious disease. No, the diseases of sedentary lifestyles are going to shorten the life expectancies of our kids and grandkids. And I submit to you that the environment we built post-World War II, totally unintended consequences, has contributed greatly to that, and that we can do better. That if we want everybody to be physically active, not just those that choose to go to the gym, that can work out, that have the wherewithal, the financial wherewithal, the emotional and mental wherewithal, the education to do that, but just somebody who wants to be able to walk their kid to school or walk to a corner store, right? Then we've got to think about all of them. That's who we got to do it for. I know it's a challenge. I know this stuff is not easy and it's politically controversial, none of which is an excuse not to do it. And just so you know, served on my planning board, which is an elected position in our town because we're the permit granting authority. So it's an elected board. Served as chair for a while. I know exactly how hard is it to sit on the side of the table that you guys sit on. And I still think we have to do it, knowing exactly how hard it is. So a privilege to visit with you. Really exciting to see all the great stuff already. As you know, as you could tell, I looked a lot at your websites. I looked at your comp plan, all the good work you're doing, some of those project pictures on site. I could have chosen a dozen pictures right from the website of your before and after projects. Great stuff. So kudos. And I'm going to follow it up with the but, which is, but you got to do more. So keep it up. And thank you so much for the invitation. It's really been a pleasure to visit with you. I'm happy to take questions as the panel's coming up. I think what's going to happen is the panelists are going to come up now. But is that right? Am I right in saying that, if I'm remembering the flow correctly?
Just raise your hand and I'll come to you.
Yeah. And you go ahead and ask me the hard ones. It's okay. I won't be offended. You can tell me I'm full of baloney or something.
Did the people that did just...
Sorry, right back there, and then I'll come up. Sorry, Ann.
Very much, and it's really great presentation, a lot of great information, and I completely agree with the physical environment and the welcoming sites and so forth. I was wondering if you had any experience or suggestions about how to make it a pleasant environment overall to experience. So, for example, here in Raleigh, there's a lot of gas pharmacy stores year-round, and sometimes I have to walk next to one or be outside and hear that. So I was wondering if you had any suggestions about making it an
So it's a great question, and you're getting at that deeper cultural shift thing. So the analogy I'll draw is, you remember at the beginning of the battle around tobacco, if I had said to somebody at the table next to me in the restaurant, hey, would you not smoke? We've got kids at the table here. They would have like scoffed at me and maybe even ridiculed me and said, shut up, go over there. It's your problem. Now that's totally reversed. If somebody were to light up in a restaurant, any number of people would say, look, I don't want to be a jerk to you, but you're really supposed to take it outside. There are kids in here. We're all eating. It's not good for the staff. So that cultural norm shift took 20 years, right? And so you're asking for a similar shift, and I agree completely. So that the people who ride their bikes aren't the wackos who ride their bikes, but that's the normal thing, right? You've traveled in Europe, if you've seen the Netherlands, right? There's 70-year-old ladies riding bikes with groceries in the basket. That's not going to happen instantly here. One thing about the pyramid is that it doesn't say you can only do the infrastructure and policy change, the stuff at the base of the pyramid, build the trails, change the pickup policies at the school, change parking policies at work sites. You know, I would love a work site like this to say, I'm not going to give any employees a free parking space. I know this is like blasphemy to say out loud, but there are places in Boston that have gone there now, right? They're doing full-on transportation demand management. You can't get a free parking space, but I'm happy to give you a free transit pass. And by the way, have a locker and a shower room and indoor bike parking. And by the way, 5 days a week, we've got a bike mechanic on staff from 12 to 2. So if you do ride, he can even fix your bike, right? You know, that's kind of the new cultural norm, right? So what we have to do is find the leaders, the innovators that will set social norms in a new way. You could do the same around the leaf blower, right? We could sort of start to reach out and talk to our neighbors about it on that very low-key level, and then eventually move to the level that we make it neighborhood policy or homeowners associations, or, you know, there are lots of ways to get to that. I just don't, my experience has been, we don't get there instantly. We imagine a path. We put a stake in the ground that would say, I'd love it if we didn't have lots of gas-powered things in all that yard care. By the way, I'd love to turn every suburban yard into a garden. I've done that. I've tried to make an edible landscape out of my front yard. I'm sure my neighbors, first few years, thought I was a total nut job. Now they're totally psyched when I show up with a nice butternut squash and a bag of tomatoes, and they're like, you know, we should start doing some tomatoes in our yard. And I'm creating this tiny little version of cultural shift in my neighborhood. As crazy as that is. So be the change, you know, and then if we get rid of, see if all the grass goes away, we don't need giant lawnmower, mow and blow operations to come in. Instead, what we'll have is guys that do remote farming, that'll do satellite farming. They'll ride up on their bike. And by the way, this exists in Northampton, Massachusetts. There are guys that do this. They'll ride to your house and farm your front yard and then share the produce with you, but the percentage they get is their pay for doing it. I know, it sounds communist. I'm sorry. I'm like, woo, this guy's way over the edge. That's what you're thinking. Did you? I thought you had
I
something.
was going to ask the kind of the stepping stones and the, you know, hay bales and things like that. Did you ask the city before you?
Always. Oh, yes. So when we do the walk audits, so I talked about when I do a community workshop, I'm hopefully walking with the city engineer, a public works director, director of planning, some parents, the guy who runs the farmer's market, the principal from that school, a bunch of parents, right? So we build these collaborative, multidisciplinary groups, but it's not all just the health people. We find often the health folks are great conveners. The hospital, the healthcare, the county health department, it depends in different communities, right? They're good at convening because they're considered an honest broker, right? You just care about the well-being of the community. That's your job. But you invite, we hope that that's how we see healthcare, or you know, the health people. Then they bring them together, right? And then when we do the walk audit, I ask the provocative questions, and then we all decide, and in fact, sometimes we end up with hay bales rather than something more substantive, because the engineer's a little hesitant. And he says, you know, could we try it with hay bales first? Before we start, you know, changing a lot at this intersection, maybe we ought to do a test and let the farmers with their trucks drive around it, make sure we get the radius right. So always, it's not like you just drop this on people, ever. Remember the first picture from Weslaco, Texas? Public Works, Police Department, City Council, and the school to paint the crosswalks.
Mark, we have time for one more question, and then we're going to move to the panel.
Yeah, I had a question and I'm loud.
Outside voice.
There you go. I'm Susan Hatchell, a landscape architect here in town, and I'm the chair of the Raleigh Bicycle and Pedestrian Commission. And one of the things we've been talking about is Vision Zero, and you have the tiny little word.
Yeah, quick notion.
I would love to hear what you have to say about that as a notion for any community, Raleigh, other places.
Yeah, so I think can I be really honest, right? The jury's still out on it. So what happened was it told a story. So Vision Zero, the premise is the only appropriate vision for motor vehicle related injuries and fatalities is zero, right? Because any of them that occur are predictable. In other words, we don't use the term accident, by the way, in the world of traffic engineering. We talk about crashes or collisions. Accident suggests it is it happened by accident, couldn't have been stopped. And engineers and planners essentially say, no, there's a reason we should be able to trace back as to why a collision and indeed an injury or fatality occurred. So the only vision we should have is for 0 of those. And we're finding mayors and councils across the country signing on to this because it seems like such a plausible and good idea. Implementation is another story because it's down in the weeds, right? It's all of the stuff I talked about and lots more that actually get you to a vision of 0. And you're back to the question asked back there, how do we shift cultural norms, right? So for example, in Seattle, they found an enforcement part of the puzzle. They had to defend crosswalks. They had to start writing tickets to drivers that roll through or sit in crosswalks because they had a big problem with people jaywalking, and they were writing tickets to jaywalkers, and they realized that wasn't solving the problem because they say, but you haven't defended the crosswalk. There's no reason for me to cross at the intersection if the crosswalk's a dangerous place to be. So they had to do that research and learn that. That part of Vision 0 means an enlightened and thoughtful first evaluation program and then enforcement program around driver and pedestrian behavior. So I think it's fine. I think it's another tag on the same kind of... do I think reducing injuries and fatalities is one of the outcome measures we should be targeting long before we target level of service? Yes. I don't want to move more cars faster until I fix that problem. So I'm right there with that premise. I just think Vision 0 is another packaging that seems to have worked well with electeds in particular. Is that okay to be that frank about it? Yeah. Good question. I'm going to sit at the panel. May I?
And thank you again. I really think he deserves applause. We are all inspired. It's impossible not to be. And so in addition to our panel being led with Mark, we are delighted to have our officials with us as well. And let me give you just a brief introduction of their bios. First, Regina Pettaway, who is our Director of Wake County Human Services since 2015, a consolidated agency. Wake County Human Services includes nearly 1,600 employees in 15 locations across the county. Regina and her staff are responsible for delivering public health, social, housing, and transportation services to a county of over 1 million people. She has served Wake County for 23 years, beginning her career as a public health field worker with the General Baptist State Convention in Raleigh before serving 10 years in state government, working on public health policy, planning, budget, and public education issues. She believes that the key success in life is forming good relationships while working collaboratively with partners to help build capacity to meet the community needs. Thank you, Regina, for being here tonight. Next, we have with us Ken Bowers, who is our City Planning Director for Raleigh since January of 2015. He has been involved with the City of Raleigh since 2006. He has overseen the preparation and adoption of the city's new 2030 comprehensive plan and a new development plan for coding and zoning to implement the plan, as well as numerous area plans and studies for North Carolina's rapidly growing capital city. He has previously served as a consultant and principal with the firm of Phillips Priest Shapiro Associates in New York City. He currently serves as the president of the North Carolina chapter of the American Planning Association, an organization that has made promoting healthy and safe communities through good planning and strategic public investments one of their 4 legislative priorities in their policy agenda for 2018. Thank you again, Ken, for being here. And then Sarah Mertz is the Executive Director for Advocates for Health and Action. Sarah has led this organization since 2014, working in partnership with community organizations, local governments, and the business community. AHA's mission is to improve health and well-being in Wake County through policy, systems, and environmental change. AHA has a 10-year history of advancing healthy eating and physical activity, including biking and walking to school and complete streets, getting fresh local food into child care and other settings, and now is a convener of the Adverse Childhood Experiences Resilience in Wake County initiative, which is aimed to build resilience and prevent and address childhood trauma, which data shows has a substantial impact on health. Sarah is also a co-founder of the Capital Area Food Network, focusing on creating local food systems to benefit farmers and consumers. Thank you to Sarah for being here. And then Ken Heisler, who has served as the City of Raleigh Parks, Recreation, and Cultural Resources Department for 19 years, currently in the role of Assistant Director. He leads the delivery of recreation and leisure programs, services, and activities across nearly 50 sites, including the City of Raleigh's community centers, athletic courts and fields, and aquatic facilities. Ken recently hired the department's first health and wellness program director, and he has high hopes for how that program will grow to serve the Raleigh community. Raleigh Parks, Recreation, and Cultural Resources maintains over 200 parks, 112 tennis courts, 9 pools, and 100 miles of paved greenway, and provides a wide array of fitness and recreational opportunities. As you can see, we have a tremendous panel here ready to speak up. So let me share a couple of questions with you. Regina, if I could, to start with you, public health services are critical to ensuring that the residents of Wake County can enjoy healthy, active lifestyles. But meeting these ever-changing health needs in this community are a significant challenge. Could you tell us how Wake County is anticipating and planning for these public health needs in the community?
Yes, and first of all, thank you for letting me be on your panel tonight. I just want to say to Mark, I'm getting me a free-range parent t-shirt.
There you go. I like it.
Because I was so not a free-range parent, but now I think I want to be at least a free-range grandparent.
Okay, good. There you go. It's easier when you're a grandparent, too.
I heard.
You're judged less, so you can just do it. Good.
So I'll be brief and give you 3 points in terms of how we anticipate and plan for public health needs. So the first thing we do is we use data, and we look at populations, where they live, we look at where services are provided, and we look at where there may be disparities in different kinds of issues that people have. There are just amazing things that you can do with data now. So we can do heat maps where we look at some of the folks that we serve for Medicaid, for food nutrition services, where our prenatal patients are. If you look at those maps and then you look at how the housing trends look, and where are the roads? Where's the transportation? Where are the food deserts? You start to see a huge intersection between public health and the environment and policy. And so we don't just look at that data, we take it to another level by then looking at what are the policies that are barriers, and how can we help people who, just because of where they live or how much money they make, have these barriers, and how can we help empower them to live a better lifestyle. And then the next thing we do is we ask people. We ask people, number one, with our partners. How many of you have heard of the Community Health Needs Assessment? I needed to have seen every single hand raised.
Right there, look at that.
Yay, Community Health Needs Assessment. So every 3 years with our hospital partners and about 20 other partners on the steering committee, around 60 to 70 partners, we do a huge survey. We ask people, what are the major problems that you're facing? What are the issues in your community? And we publish that data. So that's not the end of it. After that, we do plans, and guess what? We are starting to invest in having staff who will help us work that plan as a community. So we made major progress in not just doing individual needs assessment. Wake Med does theirs, the health department does ours. Now we want to have a community needs assessment and a community plan to address the issues that our public has raised. And so I'm really excited about the county and our partners putting together resources to actually not just do the plan, but work the plan. That was kind of one of your steps, do something. The other thing that is really exciting about Wake County, and how many of you live in Wake County? Raise your hand. You all are so lucky. I would never live anywhere else, Mark. I know good things are happening everywhere, but I would never live anywhere else. And let me tell you why. Both our municipal leadership and our county leadership understand population health. They understand that as a health director, as a human services director, I can't possibly tell people, well, you know, you're a little overweight, so I want you to get more exercise. Well, if they're not making a living wage, if they don't have a good house to live in, if there's not a sidewalk anywhere near where they are, then we have to start there. We have to start with incomes. We have to start with not just increasing minimum wage, but making sure we pay living wages. We have to look at how we're developing our land so that the people who work in Wake County can afford to live in Wake County for the long term. And then we have to look at things like food deserts together. Our partner here, Wake Med, has done that with us. They actually have a farmer's market here in the summertime, but we have to put our money where our mouths are. So if there's a food desert, you gotta, again, look at how are we developing our economy and developing our land and encouraging businesses to come to areas where people need to have food. So we're looking at that too. And then the third thing is we're looking at policy. And I'll give you a good example of that. So you look at the data, and the data says people are smoking. And so we're pretty much smoke-free in Wake County. Most of our municipalities are pretty much smoke-free. Are we totally smoke-free? No. So we need to take bold policy moves and not just, for example, be almost smoke-free. I don't want to have to walk out of a restaurant door and walk through smoke to get to my car. We need to be totally smoke-free. So as a community, we are working as a health department with folks to now face some of these policies that people were afraid of in the past.
Thank you so much. And that segues, I think, Ken, into an opportunity around the discussion Regina brought up around the plan and policies associated with that. Given your role in planning, can you tell us about some of the examples of the best practices that are occurring in the city planning targeted to healthier, more active communities that we all may not be aware of?
Well, I'd like to start by, I think in Mark's presentation hit on a lot of this. There's two types of activities. There's activity where the activity is the thing, like I'm going to go out for a bike ride or I'm going to go out for a walk, and that's the purpose of the walk is the walk. The purpose of the ride is the ride, and in order to get more of that activity, you have to bring it to people's doors and have good infrastructure. But you don't necessarily have to make huge changes in the built environment to get there. You just need good quality sidewalks, safe bicycle infrastructure, trails, things of that nature, places that are pleasant and accessible. Then there's the activity you get going about your day-to-day activities, because walking and now biking are now a part of how you get around and get from place to place. And that, frankly, is a harder lift, especially in a city like Raleigh that grew up in the automobile age where stuff is far apart, and where the retrofit of the infrastructure is not easy, and where the streets don't connect and line up with each other, so you have to go way out of your way to walk from point A to point B. So, I think the best practices are you're trying to start, where can we really create a culture of walking and biking that they're part of the day-to-day life and the normal way that you get around. And we have nodes where that is becoming a thing. I've been in and out of Raleigh for a long time. I remember when no one was walking around much, and you see a lot of pedestrian activity around Cameron Village, Hillsborough Street, downtown Raleigh, now in North Hills, and we need to reinforce and grow these nodes. I think another key thing, and I really like the fact that Mark pushed this button, is that when we're planning, we need to put the pedestrian at the center of our planning and our development standards. And our development code, I think, did a lot to do that. It mandated wider sidewalks, and every street has to have sidewalks on both sides, and it mandated bike infrastructure on every type of street section. And it created frontages to pull buildings up closer to the sidewalk. And even in the suburbs, we have this sort of hybrid frontage. Still lets you have some parking at your front door, but your building can't be hundreds of feet off the sidewalk. We were trying to plan for the transit rider and the pedestrian. And I think it's having an impact. It's making the place more walkable. But there's a long way to go to that. But I think the main thing is you got to put the pedestrian at the center, and when you're planning for walkability, you can't plan by traffic study, because the impact of the traffic study is always the same. The building needs to be smaller. It needs to be more spread out. The parking area needs to be more capacious, and the intersection needs to be bigger and have more travel lanes. And once you go down that road, you're killing the opportunity to have a good pedestrian environment. And so maybe we still have to do those studies in places where we're just going to surrender, and this is not going to be a walkable place. But for the places where we're really trying to get walkability, I think we need to put the traffic studies aside and really start planning for the type of infrastructure that makes for a safe, convenient walking experience that's fun and enjoyable. People like to do things that are fun. They don't like to do things that are tedious. You know, it's no wonder, I mean, it's no wonder to me that the person with a treadmill in their house, I can't imagine anything worse than like spending 40 minutes walking on a treadmill. I mean, it's so much nicer to be outdoors. You know, it's interesting. I can bike 100 miles, but on a stationary bicycle, after 5 minutes, it's like I can't do it. You know, it's just. So, you know, the gym is great to lift weights, but for cardio, it's a horrible place. People should be outside. Anyway, I've talked.
Hey, can I add to this? Can I make a point? So I think this is interesting, because these first two questions really, thank you. So Regina talked about the really cool evidence that they're gathering, and the fact that your community health needs assessment, we're seeing those change around the country, and we're seeing places do more than just collect like the obesity data and things like that. We're seeing those, they're often called CHNA, Community Health Needs Assessment. They're mandated by the Affordable Care Act, so we're doing them all over the country. We're also seeing communities like these two people working together on that now and starting to assess things like miles of trail, or first policy change, like the updates you just talked about, Kent, like, you know, we're changing zoning ordinances, or we're adopting complete streets. So those cannot be identified in your community health needs by saying, that's a health need, and here's the first step we've taken, a complete streets policy. The next step will be, we'll measure more miles of bike paths or on-street bike facilities and sidewalks. We'll literally, I mean, you know, just that inventory of photos showed me the many miles of sidewalks you guys have added. Well, that's a community health need now being met. Further, we've seen some regional planning entities like MPOs, like the MPO in Nashville, when transportation planners are actually prioritizing where projects go. They'll look at actual things like mix of land uses in those natural nodes you just talked about, but they'll also use your data. They'll say, what are the areas with the highest rates of cardiovascular disease, lowest rates of car ownership, highest rates of type 2 diabetes? Because that will be one of the weighting factors when we say, where are we going to do the next batch, where are we going to extend the Greenway Trail next, right? So you'll use some of this public health data that you collect in concert with the transportation data that you naturally look at and say they are now part of a fabric of analysis that we do that goes together. Does that sound rational? It sounds to me like very much the direction you are indeed going with your work.
Absolutely. And so that's a great segue over to Ken Heisler for the opportunity to integrate and partner together, as Mark was just suggesting. Where do you see the City of Raleigh Parks and Recreation really moving beyond just identification, but meeting these wellness needs for the population of our community? And as Ken said, moving it out of the traditional, I'm in the athletic club or I'm in the treadmill mode at home.
Gee, thanks. You've kind of blown up all my notes. So. No, actually, Mark, I'm going to start back because, in my opinion, parks connect people, and it's about space. And he showed that first picture, and I grew up in Delaware, where thankfully there was a school at the top of the street, and my friends grew up riding bikes and playing in the creek and skating on the pond and doing all those things. But we didn't have parks and recreation in Delaware like we have here. I'm a bit of a history geek, and if you go back to the original Christmas plan of Raleigh, they laid out 5 squares. And 3 of them still exist, and one of them is being renovated right now to become a park. So public space was always a part of the Raleigh fabric. In fact, in the beginning of those quadrants, they left space in each of the corners for what they called future park or gardens or fountains. So even though it was only 400 acres, which now we have 10,000 acres of parkland, and that original 400-acre plan was carved out of 1,000 acres of woodland, parks were a crucial part of what the fabric of Raleigh was going to be from the beginning. And so I've been privileged to kind of be a steward of that 200 years later, that we're still doing that. So, but when I think about spaces and connecting, I mean, just coming in here today, I see the partners that we're working with as a city, but I truly believe it's the spaces that make why people come here to live and work and play. As Mark talked about, it is walkable. I mean, I could give you all the fun numbers. We do have the built environment. We heard about the Greenway trails. We heard about the number of buildings in the courts and the athletic fields. One of the coolest things we're doing right now is we have some really smart people working in our planning and our GIS staff. And one of our goals is to get people within a mile or a 10-minute walk of every park that we have, to get those basic opportunities. I have a 18-year-old daughter, and I wasn't free range, but she didn't play at a creek till she was about 10. And she was like, "Dad, what do you do?" I was like, "You get wet." And I threw a rock, and she thought that was really fun, and then she got her little brother. But we want everybody to have that same opportunity. So there's a great model, like we look at, if you think about accessing park not by a car, but by a bike or by foot, it changes your access. And how do we work with the transportation? How do we work with the developers so that we can get people into those spaces? It's not necessarily building more parks, it's making them more accessible to everybody that's out there. The other thing that's really changed for me is recognizing the role that we have in the cultural fabric of health and wellness. Because you think parks and recreation, you think soccer and football and fitness centers and all that. But I've learned lately over the past couple of years, and a lot of it's Sarah's fault, so I'll blame her, is really community wellness is in the eyes of the person who needs it. Some of the stuff that we're most proud of is our work in financial assistance, our work in scholarshiping. Last summer, we gave out 60,000 meals through our summer food program at 17 summer camp locations. The fact that we can give camp away for free for people who need it. And that is wellness. For me, it's come down to a little simple thing. And working, I saw the Resilience movie. If you haven't, I encourage you to see it. And then I walked into this workshop led by the Kaleidoscope Project. And it showed the development of a 3-year-old brain. And it showed one that lives in a typical nurturing environment. They get out, they play, they have 2 parents, they do all those type of things. And they showed it physically developing. They showed the same 3-year-old brain of a child who lives in essentially a hotel room or a 1-bedroom apartment complex. It was physically smaller. And I'm thinking as a dad, and then as a Parks and Recreation professional, I was like, but it's so available. Like, we just think it's so available. So as I work with our partners and I work with folks like AHA and with WakeMed, I see the other parts of where Parks and Recreation becomes that glue. Like, most people don't think of us as a direct service provider. We're more like glue. We kind of just work through all the cracks and crevices and provide those opportunities. And occasionally we get to build a 25-mile greenway trail. That everybody thinks is the best thing, but I'm more impressed with the neighborhood park, where kids can go and have that opportunity to get out and play.
Definitely neighbor parks, one of the first things that came to mind when you asked us to close eyes and think of those early childhood memories. I too was privileged to be able to grow up close to one of those. And so Sarah, as you think about the kind of diagram that Mark shared with us around, really getting the issues moved into policy. When you think about helping goals turn into measurable outcomes, do you have advice that you feel like organizations who are trying to collaborate within the community beyond setting the goals but moving to implementation, are there particular strategies, I guess, is where I'm thinking around community health that you'd recommend? And that's for all organizations, including healthcare organizations.
Thank you. Yes. Okay, well, first of all, I want to thank WakeMed for hosting us. You probably don't know, but Advocates for Health in Action, or AHA, was actually born at WakeMed. So thank you for being a co-founder and a funder still. And then secondly, Mark Fenton's going to laugh, but it's really cool to get to be on a panel with you. So thanks. Okay, so AHA does a lot of work around policy and systems change, and that is considered, the most effective way to shift behavior of a lot of people, as opposed to individual work or telling people, like, go to the gym. So I like seeing that in Mark's material. And then in terms of how do you measure stuff, health is a big thing to measure, so it's really easy to end up measuring weight as an indicator of health, so that makes sense. And then it's hard to measure that because there's this time lag in data, right? So then it's easier to measure behaviors like physical activity or healthy eating, like make it more and more concrete and more right now. So I think there are a lot of measures like that are working, like work to get more fresh local food into kids' bellies. You can measure that, and there have been successes with that. In terms of working together, I think that's kind of the answer, is work with others who have some control or jurisdiction over the people whose behavior you're wanting to change. So, like, Ken has a captive audience of all of these children in the parks. And you guys do all this stuff with physical activity to support their health, but you're also supporting healthy, like mental, emotional development, and they're doing stuff around healthy eating. And that may not technically be Parks and Rec's job, but they do it in cooperation with other organizations. And same thing with Regina's organization. She works through AHA because of the policy and systems work, but we also try to work through human services because they have large numbers of people passing through the systems. So I would just say, work with each other and try to be nice and friendly about it, and ask for help and look at where people already are to try and change behaviors.
Thank you, Sarah. So Mark, I think you've really inspired us not only to move our collaborations to even a higher level, and you hear the commitment not only from the panelists, but all of these folks and all the folks that are represented beyond them, that are part of this community, and so appreciate you taking the time to recognize that. As you think about giving us advice, because beyond the inspiration to just speak up as we, I think we're willing to act up, I saw that in about all of us, and then more importantly, move our actions to a higher level and stepping up together, which is really the key. When you think about your understanding of not only what you had looked at and seen, and then through the interactions tonight, do you have recommendations for us as a community around where our most beneficial investments could be, not only for children, but also you brought up healthy aging adults, which we're all going to age if we're fortunate enough to keep living. And so as we think about that, do you have advice for us on what that investment might be for this community as we look to step up together?
One point you just made is really important. This notion of free-range kids, for me, kids are an indicator species, because if you can build a community for free-range kids, you're really building a community for free-range seniors and free-range people with disabilities, free-range people of lower income or who don't have a car or choose not to drive, right? In other words, because we can get it right for the kid, then that means all sorts of people can navigate that world and probably get to what they need to live and work and shop and play and learn and pray, right? So free-range kids is, just to your point, you're absolutely right. A world for them is a world for free-range seniors, and it's the world I want to age in and so on. Thank you. That's number one. And number two, I think there's an interesting point borne by the fact that we have you from the county and folks from the municipality. We do see the communities that are being really successful are thinking on a regional scale. So you've got to think about things like where development is happening and where the sprawl is and how we want to contain that sprawl and where the pockets, those heat maps are so unbelievably important because they show us where the pockets of high need are. And they are usually the same places where we see high rates of poverty, low rates of services, availability, and so on. Those maps have to become sort of guideposts. They have to help inform all that we think about with regard to our transportation planning, our zoning ordinances, sort of all the stuff that both you Kens are thinking about as you think about services and infrastructure and so on. I do think that simple mantras help. I do think that so I love everybody in the community within a 10-minute walk or bike of a greenway or trail or park space or something. And I'm 100% with you on small park spaces too. And Frederick Law Olmsted, the father of landscape architecture, would agree with you 100%. He said everybody needs a place to get outdoors, and they don't need Central Park in New York City. It can be that pocket park in their community that allows them to both be outdoors and probably run into somebody and have social interaction too in a healthy outdoor environment. But saying those kinds of things, the communities that put a goal like that out there, everybody, Park City, Utah says your front door is your trailhead. And that manifests as everybody's within 5 minutes of the trail system or a green space. 5 minutes, that's their goal. Now you say that, everybody can kind of understand that. You don't have to be a professional in planning or parks and recreation to get that. So I think those sorts of mantras. Having said all of that, the other thing that seems to characterize the communities, and it seems it's right where you guys are, where this community is making this part of the economic development model for this community. Because if it becomes central to what you call healthy economic development, then there are lots of partners, the business community, because there's maybe a flaw in the assertion here that local governments have a vested interest in the overall health of their communities. I don't know that city councils necessarily think it's their job to make me get 30 minutes of physical activity a day, but they do want businesses to locate here. And they know businesses care about what the healthcare costs are going to be and how healthy their employees are and what recruitment and retention are going to be like. And all of a sudden you've gotten to everything that we've been talking about tonight. Once I'm looking at that, and that's economics. So making a healthy community be an economically healthy community, marrying those very overtly and explicitly, and then putting policies in place to continue down that path, I think is meritorious, because I think that will reside with people who might not otherwise be in this room in this conversation. They don't want to do bike advocacy, they don't want to do pedestrian advocacy, but if you tell me I can sell this, great. Here's my last thing. I'm going to go back to one of the points I made. I do think you could continue to do some of that small stuff that I talked about that continues to begin to expand what the realm of the possible is. So we've seen some communities be very successful launching mini grant programs, and often it's through groups like an AHA or a community foundation or healthcare providers. Build a fund, and we find that if neighborhoods can apply for as little as $1,000 mini grant, $500 to do a pop-up bike lane like the one I showed, or a roundabout, or a temporary angled parking area, or take an empty lot and make festival space just for a weekend by greening it and putting mulch down and creating a stage and putting up music. So that's a land use change, right? Whether it's the network or the land use or the site design, all of the factors that I talked about can be done often for short money and as pop-ups and demonstrations. I'd say do more of that. So you're working at both ends. At the big end, it's the policy change because it's part of the economic future of the region. And there's the big stake in the ground. And at the low end, it's your neighborhood can apply for a $1,200 grant to redesign a street temporarily and prove that you can make it more humane, and therefore get a bunch of people to show up so that when Ken needs cover when they're doing a hearing, and I know what it's like to be on the commission, and when a bunch of people line up at the microphone and say, yes, we want that. We know that taking a lane away is going to change the traffic, but it's going to make it the street we want to live on. Right? And when 40 people line up at the microphone to say that, it's a lot easier to get it through the political process, right? So both. It's exactly right. Because I know the caveman is going to show up. You know who that is, right? That's the Citizen Against Virtually Everything. CAVE. Get it? It's an acronym. Yeah. So froth at the mouth. He's going to, we're doing this. I can't believe these people are making us put a trail in our backyard. That guy's going to show up at the meeting. I need 40 rational people to say, we know building this trail is going to increase the value of these homes, that they're going to sell more quickly, that this is a desirable attribute. I want to buy one of these homes. We should absolutely support this trail, right? We need to show up in force. So the big policy stuff, but find a way to do a mini grant program or something to really fuel this idea of pop-ups and more demonstrations.
Go for the policy and marry it with the...
Absolutely. The blocking and tackling that seems way down in the weeds, it seems too small to do, but it fans the flames that supports the policy.
Thank you. Ken Heisler, final thoughts on how you want to act up or step up?
Oh, can I ask that?
Hey, please, go.
If I gave you a magic wand, I call it the magic wand question. I'm going to give you a magic wand. You can change a policy right now. Your magic wand can be not, by the way, I want a $1 billion budget. If you want to make it a money thing, you have to say where the money comes from. I think we should bring a complete streets referendum to the community for a half-cent sales tax surcharge to pay for blah, 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 blah. And I know you've done some of that already. But I'd rather you, what policy would you change that you think would enhance the health of the community around the stuff we've been talking about? And you don't have to go through the legislative process. See, that's the beauty of the magic wand. You can just say, this is what we're going to do. What would your pick be? Would you mind, each of the four of you, mind throwing an idea out?
Ken's magic wand would be open use of the schools. If we could get shared use of indoor space, outdoor space in those communities to open those up for the public to use, we're gonna educate kids all day long, but afterwards we're gonna give them after school. We're gonna have more activities in the gyms. A lot of the smaller municipalities in Wake County are having challenges to meet the demand that's happening there, and they got to rent space, and it's all taxpayer dollars. Yeah.
Great idea. That's a really concrete example too. And it's doable. I know of communities that have done it. Good.
That's like my magic wand moment. So if there's anybody here from the school system, no.
Good job. Good answer.
Okay, I just want to give you a compliment there because Parks and Rec, I don't know if you guys know this, but Raleigh Parks and Rec has been working for, I would say, at least 3 years and has gotten, I think you've been working on it longer, but had successfully gotten the school system to agree to do shared use with a couple of schools in their outdoor space. So that's a really big deal, and they're going to do a test run and see if the schools can be comfortable with their worry about liability. Anyway,
Progress.
really good job, really good job. And I think I would do something around safe routes to school and supporting kids' ability just in terms of rules, right? There are some rules that make it hard for kids to walk and bike to school. There are also infrastructure issues and geographic issues too, but there are some rules that are making it hard.
I'd remove all off-street parking requirements from the code.
Wow. Right here. Give it to me, man. Right here. Give me the bump. Boom. I like it.
Okay, I'm going to go to a little bit of a different place. And I'm going to go to everybody's job. I think that we should have mandatory 10-minute wellness breaks. So you can walk, you can meditate, you can have a mindfulness moment, whatever you need to do to feel like you have more energy and that you paid attention to yourself. It's kind of like that book, I think the name of it is Your Oxygen Mask First. You can't help anybody else till you help yourself. So I think each of us need a mandatory, everyday, mandatory 10-minute wellness break.
I like it. Good.
Wake Med, Human Services, with all of our production, you know, and all the customers. I think the customers and the guests need to have that 10-minute wellness moment with us.
Good.
How about your magic one?
Oh, wow. You know what, it may sound silly, but a couple of those nerdy policies that I talked about in the communities, we did that multimodal transportation analysis change in my town over when I served on the planning board, and it didn't seem like a big deal, but now a developer won't come before our board without talking about where they're going to put the bike park, because they know I'm going to ask, right? They know they're going to get, they just say, he's going to be a pain in the butt about this anyway. We know it's coming. Let's just figure it out. Build it into the plan. I know he's going to ask about green space. I know he's going to ask about the sidewalks. I know he's going to ask about bike parking. So they know I'm expecting them to think about all the modes, not just the motor vehicle, when they come with a housing subdivision or a new CVS or whatever it is, right? Now that that's policy, that's just kind of the new normal in our community. And you may do that great already, but I'm giving it as an example of sort of so institutionalizing that it's just developers don't expect not to hear that. They expect it, and they're going to just build it into they know it's the fastest path to permit to have that stuff already built into their plan. So, and it's a practice change. It's almost a procedural change, often at the staff level. It might not even have to get voted by your board, your planning commission. That might be able to be procedural. We kind of did it that way. We sort of had a consensus discussion and then just told staff to do it. So,
Thank you all. You have done a tremendous job. In the interest of time, I want to make sure we say not only thank you to our panelists, but to you for taking time out of your busy schedules to help connect this community and move us all collectively to health. A special thanks to the entire Connect Raleigh team, Megan and Sarah and Kristen and all of you who helped put this together. We appreciate that. Councilman Stevenson, thank you so much for your leadership. And Andy, a personal thanks to you for all of your assistance. I'd be remiss in not saying again thank you to our panelists, Ken, Sarah, Ken, Regina, and Mark. I really have to say you've improved our health just by your presence here with us this evening. So thank you.